Hi, everyone. Welcome to the Prevention Subcommittee meeting once again so soon. Thank you all for joining us. I am Jessica Johnson, the chair, and we will go ahead and get the Substance Use Response Group Prevention Subcommittee for September 4th, 2024 off and running. So with that, I'll move to agenda item number 1, which is a call to order and a roll call to establish quorum. Ms. Rodriguez, do you mind assisting us in establishing quorum today?
Yes. Senator Fabian Doñate. Jessica Johnson.
Present.
Debbie Nadler.
I'm here.
Angela Nichols.
Present.
And Eric Schoen.
I'm here.
Great. Chair Johnson, we have a quorum with 4 out of the 5 members present.
Thank you so much, Ms. Rodriguez. With that, we'll go ahead and move on to agenda item number 2, which is our period of public comment. Ms. Rodriguez, would you assist us again in ensuring we're compliant with public comment?
Yes, I'd be happy to. So public comment will be received via Zoom by raising your hand or unmuting yourself when asked for public comment. Public comment shall be limited to 3 minutes per person. This is a period devoted to comments by the general public, if any, and discussion of those comments. No action may be taken upon a matter raised during a period devoted to comments by the general public until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to NRS 241.020. If you are dialing in from a telephone, please dial 253-205-0468. And when prompted, enter the meeting ID, which is 825-0031-7472. And please press *6 so the host can prompt you to unmute.
Fantastic. Thank you so much, Ms. Rodriguez. Do we have anyone for public comment?
Chair, I am looking at the participant list and I don't see any hands raised or don't see anybody that recently came off mute.
Okay. All right. With that, we'll close agenda item number 2, public comment, and we'll move on to agenda item number 3. Agenda item number 3 is to review and approve our minutes from August 26th, 2024, just most recently, of our Prevention Subcommittee meeting. If committee members have had a chance to review these minutes, I'd entertain any discussion or recommendations, and if there are none, I'd entertain a motion to review and approve the minutes.
So moved. Eric Schoen for the record.
Thank you, Mr. Schoen. Do I have a second?
Second, Debbie Nadler.
Thank you, Ms. Nadler. All in favor, say aye.
Aye.
Aye. Any opposition? And any abstentions? All right. Minutes have been approved from the August 26th meeting. I wanted to just say a quick thank you to the staff for the quick turnaround and preparing of those minutes for our subcommittee. I appreciate that. With that, we will move to agenda item number 4, which is to finalize the preliminary recommendations. I'm really grateful to the subcommittee members who have attended here today, since we will be doing a lot of deep dive into ensuring that we have robust recommendations for the October presentation to the full SURG. So grateful to the folks who are on and the subject matter experts who've joined us for discussion. So I wanted to start with the 3 recommendations that were approved during our August 26th meeting, and the changes that were made. That was recommendation item number 1 from the annual report, recommendation number 7 from the annual report, and then recommendation number 8 for anyone following along at home. The changes here are identified in red for what was changed in those and approved by the subcommittee in those meetings. And specifically recommendation number 8, I wanted to thank Vice Chair Schoen for adding some additional information gathered for the justification, which is included on the next slide here for these proposed changes. Anything additional, Vice Chair Schoen, you wanted to add on this justification and background?
No, except to give a shout out to Cody Wagner with the Nevada Community Health Worker Association. He reached out to me and shared with me this resource, which was exactly, I think, what was suggested that we do by Senator Doniate to include this information. So it was nice that we closed that loop so quickly.
Yeah, wonderful. I really appreciate the additional information here to the justification and background to help sort of create, to support the language that we had changed here together in this last recommendation. Since this is for possible action, I'm wondering if we could just vote on recommendation number 8 with the additional justification gathered to continue to move that forward in our final list of recommendations. Any further discussion from the committee on recommendation number 8? Great. Hearing none, I would entertain a motion to approve recommendation number 8's additional justification and background into the final report that we're preparing.
Debbie Nadler, for the record, I make a motion that we approve.
Thank
this
you, Ms. Nadler.
recommendation. Thank you.
Sorry, go ahead. Thank you, Ms. Nadler.
No, I was going to finish. That's okay. Thank you.
Do I have a second?
This is Eric. I'll second.
Thank you, Eric. All in favor say aye.
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 Any opposition to the additional justification and background? And any abstentions? All right, we have 3 finalized recommendations with justification and background to move to the final surge for discussion on the October 8th. Thank you. We have 6 remaining recommendations for discussion and potential revision today, along with 2 new recommendations received from the between the August 26th meeting and today for discussion and review of the details so far. So thank you to committee members who worked with staff to prepare some items for discussion and consideration at the full committee today. Again, the changes in red that you see on the screen would be any new information collected by staff, SMEs, or subject matter experts for consideration and discussion today. So the first one, it was recommendation number 10 from the annual report. We heard a presentation on this from Colorado, as everyone will recall, and earlier in August. This is related to a change in the Nevada paraphernalia definition as it relates to smoking supplies, either utilizing Maine or Colorado as examples to modify the NRS. At the direction of members of this committee, staff reached out to subject matter experts to get a better understanding for feedback on this recommendation. DA Shields, who represented the Nevada District Attorneys Association, Christine Payson, who's a SURG member and was appointed by Nevada Sheriffs and Chiefs, and then the director of the Department of Indigent Defense Services, and we're currently awaiting feedback from Ms. Payson and that director in terms of modifying any language associated with this recommendation. I don't know if DA Shields is on the call today to help us workshop this a little bit more. Ms. Rodriguez?
Chair, I was looking, I know he was going to try to attend, but I don't see him on the participant list. I don't think he's currently present.
Okay. So at the direction of this committee, staff did work to get additional insight and recommendations for how to adapt this particular language for the BDR. Still awaiting some of that SME review and how we could consider making this language more actionable. I'm wondering at this time if there's any further discussion from the committee on this particular recommendation.
Well, Chair Johnson, just to sort of state, I think, the context here, we're feeling cautious about making a recommendation until we hear from the subject matter experts about the possible implications of such a recommendation for law enforcement. We don't want to create a conflict or a tangle or an encumbrance. If I'm wrong on that, please correct me. That's what I'm remembering. Is that an accurate way of stating that?
Yeah, from the minutes, my recollection was that we were asked to reach out specifically to the public safety sector for additional guidance or direction. And when I did have an opportunity to meet with DA Shields briefly, as written, it didn't sound like there was a lot of support at this time from the Nevada District Attorneys Association, but did look for an opportunity to create a more actionable conversation around that, to understand what might need to be modified or changed in this to help support or move the recommendation forward. And no suggestions were made at that time to help this be more actionable or more concrete for the committee to consider in discussion. So still awaiting some feedback at this juncture for this proposed recommendation.
I would agree with that. I feel we need to have that. I'm not sure I'm comfortable going forward without that feedback.
Thank you, Vice Chair Schoen. Any other discussion from committee on this recommendation? So given the feedback so far, I'll work with SEI staff to continue to reach out to see if there's any additional changes, or if time allows, perhaps we can revisit if any of the SMEs are able to jump on later today and see if there's opportunity to have a discussion about what modifications to what is currently written, or if there's a preference from the guidance from Maine or Colorado as written in terms of what would make a more actionable bill draft request. I was really grateful to DA Shields for his time and the opportunity to share a little bit about the spirit in which this particular recommendation was written and some of the background and justification that was provided to just sort of share both of the fields that we come from are different in this work. And so I think it was helpful discussion on that front. So Emma, it sounds like, or Ms. Rodriguez, it sounds like this one is still pending, and perhaps we can either get some additional guidance at the full SURG meeting on this BDR and revisit it at our November meeting. With that, we can move to number 13 in the annual ranking and reports. This was to establish a statewide initiative for community drug checking. We received some subject matter expertise feedback on this at our meeting earlier in August, which was here in red to utilize a regional implementation approach with standard statewide indicators, since local jurisdictions were best equipped to respond to the findings from community drug checking. So in this recommendation, supporting a local implementation with some opportunities to comment or measure at a statewide perspective. So as mentioned, this was workshopped in our August 7th meeting, and would be happy to, and again, thank you, Ms. Rodriguez, that an additional action step was updated and some other details around capacity and feasibility of implementation, which is on the slides. Would be happy, go ahead.
Yeah,
Would be happy
Chair
to entertain
Johnson,
discussion.
I still think this would be a fantastic strategy for the reasons we talked about before. It's like tracking viruses, so you know where there's hot spots. This would give us the same kind of hopefully big picture perspective that would help to help us to maybe marshal resources where we needed to, or move ahead of potential waves. Again, I'll just state, not my area of expertise, so I don't know how to get any closer than what we've got here. I'm happy to move this forward because I think it's an important concept, but somebody who is familiar with setting up that kind of an infrastructure or environmental scanning kind of system, I think would need to kind of tighten this up for us somehow.
Thank you, Vice Chair Schoen. I appreciate that discussion, and I agree that I think that this has improved in terms of actionability. Ms. Rodriguez, if you could take us back just one slide, if you don't mind. In terms of that we're getting closer for this kind of statewide initiative, but doesn't quite yet have the actionability that some of our other recommendations do at this time. And perhaps as this committee has done, continuing to revise as new data, new projects, and new programs become available over time might be the best course of action if the committee feels ready to take a vote on the language as written for our 2024 recommendations. Any further discussion on this?
Of course, I'm going to have more discussion. So our last report came out in January, February, March of last year, right? And that's projected time frame for this one as well, correct?
I believe so. That
Yes,
would be, yeah, go ahead, Ms. Rodriguez.
Yes, for the record, by law, it needs to be submitted by January 31st of each year.
Okay, so that last report did have this recommendation generally written. Is my memory correct? I'm sorry, I don't have any of my documents in front of me. I'm just trying to make sure I'm not misspeaking. So yes, so far?
Yes.
Okay, so I think we don't have to re-propose this, I think, for the next year. If we wanted to give ourselves some time to try to tighten it up, we could. And the reason I'm saying that is for those people who've been following what we do, they've already seen this recommendation. And I think if somebody's already considering a bill draft, then they have that, they're already considering that now, not by the time this next report will come out, which is, the session's already going to be started by then. I'm open. If somebody thinks there's utility to approving this with this a little bit more additional specificities, we certainly could. I'm not sure it's imperative.
Yeah, thank you, Mr. Schoen. I think to that point, I would add that I would be in favor of us moving this forward, simply because I know that the action steps associated with these aren't always BDR related. Perhaps there is opportunity for an entity, a coalition group, an other type of group to start some type of statewide initiative that looks to centralize these efforts.
Okay.
Sorry, Ms. Rodriguez, can you flip to the next slide? I don't know what the action step we identified was, but I think they're pretty similar to what's included in here. So I think this my interpretation of this is it's more visionary and less concrete
Okay.
of what the committee is suggesting, and rather than starting at the state level and moving locally, from my reading of this, the language in red encourages sort of more regional implementation to then grow together at the statewide level.
And I appreciate that additional context. So based on that, I would make a motion to approve moving this recommendation forward with the additional clarification that's been added in red.
I'll second that motion, Debbie Nadler.
Thank you, Mr. Schoen and Ms. Nadler. All in favor, say aye.
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 Aye. Any opposed? And any abstention? All right. This recommendation and the motion carries to move this recommendation number 13 forward as amended with the text in red. We will move to recommendation number 14. This again was a recommendation. This is related to a statewide shipping for harm reduction supplies and services. We workshopped this with discussion from Rick Reich and Kat Reich with Track B or Impact Exchange, their presentation to us on August 7th. We received some additional follow-up information from Mr. Reich regarding the budget. I think was kind of our outstanding question to make this more actionable, was to better identify what the gap was. So staff gratefully received some budgetary feedback from the Impact Exchange team. It sounds like, based on a summary of what they proposed, that there would need around $80,000 to scale up their program, primarily with a primary focus on rural populations. There is still a gap in understanding around what sort of current funding is established, which I think was our question. But the question that was answered was more around what it would take to scale this up for broader implementation, particularly among rural communities in Nevada. But based on this information, these are the proposed edits, or I guess modifications to the report as currently written. Happy to entertain any discussion from the committee. And thank you, Ms. Rodriguez, for hopping to the impact slide and additional details around capacity and feasibility.
Well, Chair Johnson, based on the testimony that we heard in our last meeting about the ancillary benefits, not only of the harm reduction materials, but also the additional messaging, the relationships that are built up, and that there aren't really very many other avenues for doing so in rural Nevada because of the vast spaces. I would move to approve moving this recommendation forward with the additional language highlighted, indicated in red.
I'll second that motion, Debbie Nadler. Yep.
Thank you. So I have a motion from Mr. Schoen, a second from Ms. Nadler. All in favor, say aye.
Aye.
Aye. Any opposition? And any abstentions? All right, we will move recommendation 14 forward as amended. And a big thank you to the folks at Track B and Impact Exchange for providing such great insight into recommendation 14. All right, recommendation 15 is around a bill draft request to equalize peer recovery support specialists as was originally written. Vice Chair Schoen has worked hard on this to propose some additional details and feedback, and I think was awaiting to hear from the Northern Nevada Regional Behavioral Health Policy Board or anything from the presentation that the committee received last time. Before I turn the floor over to Vice Chair Schoen, I also received a memo from Trey Delap with Group 6 Partners, who I'm hopeful, if he's available and comfortable on the call today, can help us weigh in as a subject matter expert on this particular legislation. A really robust memo with a lot of detailed background regarding the legislation, sort of the history of this work in Nevada and how it's really evolved over time. And if there are, if the committee is open to that, being able to receive any feedback around this particular recommendation, or if there's an opportunity to share the memo either today or on a document for the committee's consideration for any updated language going forward. So happy to hear Vice Chair Schoen, if you have any additional information regarding this.
I can just confirm that this is what's being put forward by the Regional Behavioral Health Policy Board that you referenced. So the idea for the association is basically modeled after the what was put forward for CHWs. It's another vehicle that we hope to be able to utilize for employing peers across the state. So it's modeled after that, and then it was recognized that some supervision requirements were needed for peers under the age of 18, and that's been put forward as well.
Thank you so much, Vice Chair Schoen. Mr. Delap, I don't know if you are available for any thoughts or comments. No problem if you are not. I don't want to put anybody on the spot.
Madam Chair, I am available.
So I wanted to first thank you for the memo provided. I am working to share that out with the committee so that we can continue to create a robust justification and background for the CHW and PRSS components. Based on sort of as a subject matter expert in this area, is there anything additional based on the language here in red or elsewhere that you'd recommend for consideration with the committee at this time?
Madam Chair, Trey, for the record. So based on the red language, recommend a bill draft request to support legislation that will, 1, help the fund establish the statewide association for peers, and 2, better define supervision requirements for peers under the age of 18. It's based on the history of the regs and how this was presented in the August meeting, or the earlier August meeting. There's some history with the regulations and peers in particular that is a little bit distinctive from CHWs. That goes back to 2017. The main issue that was the result of all the stuff was the community worker pool and the peer recovery pool regs came out of DHHS. They were challenged at every point for improvement. DHHS did not accept that. Ultimately, it went to the Board of Health, and it almost died by a second, but Linda Anderson rescued them with words of wisdom. And then Legislative Commission considered it, and ultimately the regs passed, but the governor did not allow them to be enacted. And the main argument was the inequality issue. So the issue there was peers in a facility could be trained and offered to service population. Peers in community organizations, ergo the peer pool, would have to go through certain education, certain training, certain hours, other things. And so the public receiving peers would get the same credential and yet vastly different training expectations. So that was an inequality argument that the Governor Sandoval at the time agreed with. So I think whoever agency was in charge of this did prepare for a license process, but it was never unleashed. So that was kind of the issue here, and that is a little distinctive from CHWs.
Thank you so much, Mr. Delap, and letting me call you in as a SME on this. I appreciate it. Wondering if there's any further discussion from the committee, or if Vice Chair Schoen, if you'd be interested, if I can share the memo I received and any additional workshopping on this to bring back to the committee at a later date. Wondering your thoughts, or if you're ready to move recommendation 15 forward. Just wanted to kind of get your pulse.
I would just add that the recommendation that was put forward by the Regional Behavioral Health Policy Board was led by our so I'm more of the advocate on the CHW side, less so on the peer side. That's, as Mr. Delap pointed out, a separate sort of specialty, and that recommendation was brought forward under the leadership of our two foremost experts on our board for utilizing peers, one who works for NAMI and one who is actually the Regional Behavioral Health Policy Board Director. So they both felt comfortable with this language, but what I'm hearing is that this additional context might mean that I think we should take some time and see if we can't tighten this up some.
Okay, thank you so much for that consideration, Mr. Schoen, and the opportunity to share some additional contextual information. I'll work with the SEI team to share the memo with the committee, and then everyone obviously on this meeting will work to get that posted so we can share that out. And I in that appreciated sort of Mr. Delap had kind of multiple recommendations that did build on our current recommendation number 8 alongside this one. And I know we've moved the language on 8 forward, but just thought there might be some additional justification or background or consideration for the committee as we thought about how to best actionize some of the details around both peer recovery support specialists and or community health workers in this space. And really grateful to your background work and work across the state, in addition to Mr. Delap's, to help move this work forward.
And Chair Johnson, can I note something? Emma Rodriguez, for the record, I just wanted to note that that memo has been sent to Ashley Tackett with the Nevada Attorney General's office, and she let me know that it's in the process of being posted on the website. There's kind of a lag time. So that will be available to the public, and at that point we'll send it to the subcommittee members, so everybody's getting the same information at the same time, in accordance with the open meeting law.
Thank you so much, Ms. Rodriguez, and a big thank you to Mr. Delap for preparing such robust information, I think, for the committee's consideration. So we will, I'm hearing hold agenda 15, or sorry, item 15 as is. We can discuss it at the larger SURG meeting in October. So if there's any work that has happened or recommendations to the justification or background, I'd be happy to present that at that meeting in October, in addition to finalizing our recommendations in November with this committee. All right, we will move to our next recommendation, which is number 18 in the annual report rankings. This was a recommendation around to model legislation around Maryland STOP Act. And at the August 7th meeting, our committee discussed some opportunities to maybe amend this particular legislation, either working with CPR providers for overdose education or other entities. But after additional consideration, I think that given that many of those trainings are private or not regulated by any particular entity, it might be really difficult recommendation to implement. And in consultation with subject matter experts around Nevada's law that supports dispensation of naloxone. It doesn't currently prohibit any of these particular activities. So I think my summary of all of this to the committee is that at this time to remove recommendation number 18, given that there are many efforts sort of happening around this particular work, and that it may already be encompassed in what's happening across the state. Open to hearing discussion from committee members around potential removal or other modifications to the recommendation as written. Hearing no discussion, I would also entertain a motion to propose removing recommendation 18 from the 2024 report.
Debbie Nadler, for the record, I approve removing this.
Thank you, Ms. Nadler. Do I have a second?
This is Eric, I second.
All right, thank you, Mr. Schoen, for your second. All in favor, say aye.
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 Any opposition? And any abstentions? All right, we'll move forward with removing recommendation number 18 for our annual report. All right. The last of our augmented recommendations is in recommendation number 5 from the annual report. This is around the tobacco control and prevention set aside. At our last subcommittee meeting, we determined that we would revisit this particular recommendation and support a potential creation of a separate recommendation related to cannabis, which subcommittee members have drafted and will be happy to discuss at this meeting for input and consideration as I think our next item that we'll be discussing. So I know we had a pretty robust discussion about this particular recommendation. The other change to this was an action step that was to create a bill draft request. I think the action step previously was identifying funding sources, but the funding source recommendation was then incorporated into the actual recommendation language. So now the action step would be creating a bill draft request that would modify this. I'd love to hear if there's any further discussion from the committee on this particular item.
Chair Johnson, Emma Rodriguez, for the record, I just wanted to note that subcommittee member Senator Donyate just joined the meeting.
Thank you. Welcome, Senator Donyate. Any additional language or any additional discussion on this item?
Debbie Nadler speaking, sorry. So would the whole, is it this or is it the slide before?
So this is the details. The slide before is the actual recommendation and for consideration. And at our last meeting, we had discussed creating a separate recommendation related to cannabis, which will be a new recommendation. We'll present both of the new ones next.
How hard is it to add? I'm afraid the marijuana won't go through. I'm just wondering how hard it is, and why we can't add marijuana to the tobacco. I mean, it's a smoke-free coalition. People are smoking marijuana. I guess maybe I could be a little confused why I was hesitant before, because I've done so much research. I'm not an expert by any means, but I've looked up every school in our state and in other states. And at this time, kids are vaping more than they're smoking. Smoking cigarettes is not cool to them. So I know it says tobacco control. Is this going to focus more on vaping? Because they're vaping and they're smoking marijuana.
Thank you for your comment, Ms. Nadler. So after the last subcommittee meeting, I did reach out to the statewide SME on who presented on this particular legislation, and asked them about your question of adding, if their recommendation would be to add cannabis control to this recommendation or to create a separate bill draft request, and their recommendation was to create a separate bill draft request because the funds that would be recommended to be utilized would be a separate set of funds that would govern this effort. So in the first sentence here, it says a 15% set aside of tobacco control and prevention funds from the Fund for a Healthy Nevada. In the cannabis recommendation, there's a separate set of dollars that would be supported to help move this forward. I don't know if that answers your question or not. Separate pot of money, I guess.
Okay, so I guess what I'm saying is, if I'm not mistaken, I'm just gonna go. Excuse me, I'm sorry, but don't we have? I just looked it up, and I could have read wrong, but isn't there another tobacco lawsuit going on where we're getting more money, and that's a separate entity, and we already had a tobacco, and not that I don't want this, but I'm going to be truthful here because I don't have a job to lose. I feel like marijuana is so dangerous and it's legal in our city. And if we don't, I feel like, I don't know how to express this in words right now. I'm sorry. But I feel like not y'all, I'm sorry. The higher uppers don't want anything to do with marijuana because it makes our state a lot of money. And it's really, a lot of this is very, especially the education part. Every time we start talking about education and prevention, it seems to flip into something else. And I know we're doing harm reduction but I don't understand. I really don't understand. I mean, in order to stop it, we have to prevent it.
Yeah.
Anything. And I just feel like the funds, I don't see enough going for our youth here. And believe me, 50% of our kids are smoking marijuana because they think it's okay. And there is so much death, suicide, psychosis, especially in the level of THC we have in legalized drugs here in our state. So I'm really hesitant about passing the smoking tobacco thing without doing the marijuana thing. And I'm sorry, I'm just very passionate about this.
Absolutely, Ms. Nadler. I hear your concern and your passion coming through. Mr. Schoen, before I turn the floor over to you, so I just want to make sure that I'm understanding your concern here, Ms. Nadler. At your recommendation, staff and myself as chair followed up with the SME who originally helped us create this recommendation to see if there were A, any updates, and then B, if they would support a separate recommendation related to cannabis that was submitted that I plan to present after we discuss this one. So I am not trying to sidestep your concern or not hear where you're at, but the folks at the Nevada Tobacco Control and Smoke Free Coalition recommended that this committee consider two separate recommendations, one concerning tobacco control and one concerning cannabis. Neither of those directly, Emma, if you could just flip to the next slide really quick, I want to make sure that I'm not speaking out of turn. Neither of those, oh, sorry, no. There are additional, sorry, this is what I was looking for. That tobacco is still a large share of preventable deaths, and the mechanism of vaping would be included in as a strategy, is my understanding, in both recommendations.
Okay, so vaping will be included in this.
Yeah, in the urgency and what was shared at our subcommittee meeting last year is that vaping would be a mechanism. So the efforts surrounding if the individual was vaping tobacco or cannabis or another type of substance, I assume, would be in that those vaping prevention efforts do focus on youth. And that would be something that could be included in either or both, depending on what the prevention audience was and what the risk factors were from the committee in a braided fashion as they worked for prevention. I don't know if that clarifies your question or
no, the
helps to...
vaping. Yeah, no, I mean, vaping, they're all vaping. I mean, whether it's nicotine or marijuana, whatever, they are vaping, these kids.
Yeah, and my recollection, and I'm happy to go back to the notes on this, was that the impact of this would be being able to comprehensively address those efforts, including both the risks related to vaping tobacco and to vaping cannabis.
Okay, thank you.
Hopefully that helps make sense. Mr.
No,
Schoen?
no, it does. Thank you.
Okay, thank you. I wanted to make sure I answered your question. Vice Chair Schoen, did you have something additional to add for discussion?
No, it sounds like your reply helped Debbie with additional information, some additional context. So I don't have anything else to add.
All right, excellent. Any additional discussion from this committee related to recommendation number 5 in the annual report rankings?
Debbie Nadler, sorry, one more question. On this, did we have an age group we're focusing on? Does that need to be identified within the youth? I mean, is it middle school? Is it high school? Did we talk about that? Sorry.
Yeah, no, great question. We do, and the populations that were selected, I don't know if they're on the PowerPoint, but they are in the listed recommendations. Yeah, on the 2023 recommendations include populations that focus on youth. So off the top of my head, I think that's like the LGBTQ plus population. So within the focus of SURG, we have our priority populations. The LGBTQ plus population, I think it's listed. I don't want to misspeak. Ms. Rodriguez, do you happen to have those populations handy or can direct folks on this call to where to find them?
So it's in both the 2023 annual report and in the handouts that were posted for the previous meeting. And I'll just read them right now. So the special populations for this recommendation were identified as veterans, elderly populations, and youth. That's grouped as one group in the legislation. So I think this is probably speaking more specifically to youth, but also to veterans and elderly populations. Lesbian, gay, bisexual, transgender, and questioning persons, children who are involved with the child welfare system, and other populations overly impacted by substance use disorders.
Thank you, Ms. Rodriguez, for reading that out for the record. I do know that it's in the handout. I didn't have that in front of me, so I apologize and thank you. Ms. Nadler, does that help answer your question?
Mostly, is this, I understand it's for everybody, but is this, are we going to implement this in the classrooms?
Great question. I don't know that the SURG has really taken on that level of detail of implementation. If passed by this committee today, we could follow up with some additional action steps. But in order for this to be considered, my understanding is that there would need to be an amendment to the NRS for the funding to be able to be moved forward with the bill draft request.
Nothing for our youth. Okay.
Sorry.
No,
I can look back to our SME's presentation, but there was quite a bit of data presented around vaping prevention with
Okay.
youth that was funding. I think part of the impetus for this was that funding had been discontinued. And so this was an effort to help
bring
reestablish
it
those
back. Okay.
vaping prevention programs, but I'm happy to work with staff to go back to those minutes since that presentation was July of last year.
Okay. No, okay. I fully understand. Thank you. I was
Okay,
confused
thank
on
you.
something last time. Thank you.
Thank you all for a really robust discussion. I am wondering if this is a recommendation that the committee is ready to move forward and move to our as the language as amended for our presentation in October, or if there's still some additional background information and details that would be helpful for the committee.
Yeah, Chair Johnson, I'm ready to make a motion to try and move this forward again.
I'd entertain that motion, Mr. Schoen.
Yeah, so I would move that we move this recommendation forward for number 5 regarding setting aside 15% of tobacco control and prevention funds from the Fund for Healthy Nevada and the rest of the verbiage that's in there.
Thank you, Mr. Schoen. Do I have a second from the committee on this recommendation? Senator Dunyate?
So moved.
Thank you so much. I have a second from Senator Dunyate. All in favor of this recommendation, say aye.
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 Any opposed? And any abstentions?
I abstention. Debbie Nadler for the record.
All right. With Ms. Rodriguez, per quorum, are we still able to move this forward? I believe so, but I wanted to make sure maybe the DAG can help us.
Yes, I'm not sure which DAG is available today. If they could come off mute. I heard 4 out of the 5 subcommittee members weigh in. Is that enough? So there were 3. Well, I don't know, Chair, if you voted.
I did. Yeah, in
Okay,
favor.
so we had 3 out of 5 subcommittee members, 1 abstained, and I did not hear 1 vote any particular way.
So did 3 vote in the affirmative? Sorry,
Yes.
just, Deputy Attorney General, if 3 voted, in the affirmative, I think it passes. Is there 5 members total?
Yeah, so it was a quorum of, yeah.
Okay, yeah, I think that's fine. I don't see an issue. Is that what you were asking? Sorry, I wasn't.
Yeah, no, that's okay.
Okay.
Thank you. Thank you to Deputy Attorney General. I hope I got your title right, sir, and and to Ms. Rodriguez for that. So the language moves forward as amended. Thank you so much. All right. We will move to the 2 new recommendations that were proposed between now between our last meeting on the 26th and today's meeting. So the goal of sharing these out today will be for workshopping by committee members. And if additional details are needed, we can go back and get those in between now and the next meeting. So the first one that we will present will be around cannabis prevention. So the current language here is modeled after the language of the tobacco recommendation, and as currently drafted, create a bill draft request to allocate a 15% set aside of cannabis retail funds to be distributed using a local lead agencies model to reach $2 per capita, which is a recommended funding goal from the Nevada Tobacco Control and Smoke-Free Coalition and their subject matter experts. I am happy to hear any discussion from the committee or any additional feedback on this recommendation as proposed.
Debbie Nadler, for the record. Is there something set? Is there a bill that's already in place with the cannabis prevention that has additional wording, perhaps? Or this is the recommendation to create it like the tobacco one was created?
Correct. So just to be clear, the tobacco one has not yet been created. The recommendation would be to create a bill draft request for legislation related to tobacco out of this committee. And then this, again, a separate recommendation to create that for a set aside of the cannabis retail funds for these prevention efforts.
Okay.
Hopefully that answers your question.
It does. Thank you.
Other discussion from committee members or recommendations?
Debbie Nadler again for the record. Is there a way to tie it in when the cannabis prevention, to tie it in with education, something to do with our classrooms or schools?
Yeah, I believe in the justification, the committee, again, thank you, Ms. Rodriguez. So working with statewide SMEs on this particular topic, this background and justification was prepared. So the Nevada Tobacco and Smoke-Free Coalition pulled together both a brief on the funding amounts and dollars received and the impact on the youth population. So in preparation of this to discuss at the committee today, again, selecting those populations focused on impacting youth. And they, the Nevada Tobacco and Smoke-Free Coalition created the recommendations 1 through 7 listed below for funding allocation and best practices on how this type of work could be operationalized. Education and prevention is listed alongside treatment and cessation, supportive school practices, youth engagement, parent and community outreach, data collection, and cannabis product waste disposal, and promoting environmental awareness. Again, that still looks like it's a focus on youth as well in the description.
Well, this covers that. This looks good to me personally. This looks good.
Thank you for the feedback, Ms. Nadler.
And Emma Rodriguez, for the record, I also wanted to share that Ms. Nadler, these include the links that you had sent me via email. So all of the research that you did, I added to the research and links part as well.
Thank you.
Thank you, Ms. Rodriguez. So again, in the recommendation section, the special population section, where if there's no further discussion from the committee today, the sections of this that still needed some, with the turnaround time, wanted to prioritize working on the language at the committee meeting today, and in ensuring that there wasn't any additional direction at this time from the SMEs on this committee. And if there is not at this time, would be happy to work on with staff on the impact, urgency, capacity, feasibility, and racial health equity sections to be drafted and shared out for first time consideration at the larger SURG meeting in October, and then for finalization on this committee in November. That's a task I'm happy to take on, or if there are additional committee members who are interested in drafting that, happy to also support those, but open to any further discussion at this time.
Debbie Nadler for the record. I'll be happy to help you, Jessica.
Thank you, Ms. Nadler. As long as we can communicate with Ms. Rodriguez to share those resources, happy to receive any additional details or discuss these sections as recommended.
Thank you.
Any further discussion from the committee on this item? All right, hearing none, wanted to, so then we will move this forward for additional refinement at the larger SURG committee meeting for presentation, and adding in the additional details from the sections that have yet to be drafted, and we'll move this forward as a new recommendation. Hopefully, sorry, not a new recommendation yet, but to be voted on by this committee, and the final as the final language is there. Unless the committee would prefer to, seems like we probably need the additional details. Is that your recommendation, committee members, to provide the additional details, and then we can have a vote at our November meeting?
I would agree with that plan of action, Chair.
Okay.
Eric, for the record.
Thank you, Vice Chair Schoen.
Yeah, I agree. I agree too.
All right, fantastic. Our second new recommendation is around student ID cards. Ms. Nadler, if it's all right with you, I'd love to turn the floor over. I know you've done a lot of work to submit this particular recommendation, and open to you for discussion.
Thank you so much. And I might get the year wrong, but we already have a bill in place. It's the it's stated the NRS 388.1.4 something. Can't read it on my thing. It's already in place and it was passed. And Jessica, correct me if I'm wrong. It was passed in 2022.
I would have to defer to Member Nichols on that, but I imagine it would have either been 2021 or 2023.
Yeah, Angela Nichols for the record. I couldn't say for sure, but 2022 sounds correct.
Okay. So we had talked about this, I think the meeting before the last, one of the past couple meetings, and we were told that it was being done, that the suicide hotline, the 988, and a safe voice was required on all middle and high school student ID cards. I spoke with a bunch of parents throughout the city, Henderson and Las Vegas, and half the ones did not, their kids do not have anything on the back of their card. A lot of them have, if you lose this card, you have to pay $25 to replace it, or 50 or something, maybe it's 50. So I took it a step further and I called the CCSD, and I spoke with many different departments to see where the lack of communication was, why it wasn't all being done. And bottom line, I found out that each school has different photography vendors, and half of the vendors didn't get the memo to put those, the helpline numbers on the back of the student ID cards. So what they were trying to do was make stickers to stick on the back of the student ID cards. So the person in charge of that is the Nevada government part of it. I got all the way up to the government relations department. Dr. Keating, he's in charge of the stickers. So I was told they're being printed out now, and this was 2 weeks ago, or just about 2 weeks ago. And then I asked, how is there going to be an email blast to the principals to make sure that the stickers are put on the back of the student ID cards? Is there some kind of central person who's overseeing that this is done in all the schools? And I couldn't get an answer. So I thought that perhaps, and also there's 9 states that are doing it right now. And I looked up the California one, and they have it in Spanish too, and we don't. And I thought that might be something important to maybe in the future add.
Thank you, Ms. Nadler. So just to summarize, thank you for the background work and summary on this. So sorry, Emma, if you could flip to the previous recommendation. So the recommendation for consideration or editing on the floor right now is to conduct an audit of a sample of Nevada middle and high schools to determine if schools are in compliance with the NRS listed here. And if the audit shows that they're lacking required information, understand why, and work with schools to ensure better communication and implementation. I'd entertain comments or discussion, or edits, suggestions from the committee. Senator Duniate?
Thank you, Chair. This is difficult for me. I'm generally not in support of this recommendation. It's not against Ms. Nadler's effort. The reason why I am against this recommendation is if there is, so this was actually Senator Dondero Loop's bill in the 2021 legislative session. She was the one that sponsored it, and there was actually a student sponsor that brought it forward. If there is consideration of the bill not being implemented, my recommendation would be to go through the bill sponsor and have them call whichever school district is not enforcing it, because it's already established via state law. If it's a consideration for funding or a lack of coordination, that should be a response from the school district, and they have to bring either an unfunded mandate recommendation or through some other procedure, rather than us conducting the work. So I see this more as a lack from the school districts of not following state law, and it shouldn't be the responsibility of this committee to follow up on that. I would encourage Ms. Nadler or any of the community members to follow up with Senator Dondero Loop, especially because she chairs Senate Finance and she can allocate resources to the schools to implement it.
Thank you, Senator Duniate, for that recommendation. So I'm hearing rather than conducting an audit might be a recommendation from the committee to provide this the data gathered to date and information to the original bill sponsor as an amendment to this recommendation. Ms. Nichols, go ahead.
Hi, again, Angela Nichols for the record. I would just agree with all of that because there was with the new in the district, like every kid has to have the ID badge. And when I tell you that information went out to every single principal, and there was a ton of discussion around it all summer long, that absolutely happened. And the district itself does have procedures in place. So to a high degree, it boils down to a supervisory issue up to the associate superintendents and so on and so forth. And just for awareness, in the Clark County School District, it's Kevin McPartland's department who's been pushing out that information with regard to it.
Thank you, Ms. Nichols. So I'm hearing, in addition, perhaps this committee could amend this recommendation to follow up with both the bill sponsor of this particular NRS, in addition to the staff member that you mentioned, with some opportunity to understand the implementation and communication around the student ID cards. Does that summarize some of the feedback so far? No, I'm missing it. Senator Duniate, please hop in.
No, so I don't think this recommendation should proceed. It can be a simple request to letting Senator Dondero Luke know, a simple email from either the committee member or from the committee itself. I can text her right now and let her know. I don't think we need to waste any more time if it's just notifying them that the bill's not being implemented. So it's a very simple task that legislators are supposed to follow up on.
Thank you for that guidance. Ms. Nadler? Any further discussion? Sorry, I saw you come off mute.
No, as long, oh, sorry. No, I think as long as somebody is willing to go the extra mile, whether it's us or the person who drafted the bill in the first place, as long as it gets done, it's very important for these kids. Look what is going on with our youth today. It's horrible. We just had a school shooting today. I'm sure you all know. And it's imperative. I'm holding on to my son who passed away, his ID card. I found it when he passed away, and I looked at the back and there was nothing on there. And I found his journals, and he journaled because he wouldn't come to me. He wouldn't tell me. And there's these kids have got to have, there's kids who have problems at home. Both parents are working, they're working hard. I mean, we're talking about prevention. This is part of prevention right here. It's imperative that these kids have these numbers and have access. If they're being bullied, they're going to be too afraid to tell their parents. They're not going to tell their teacher, but to have something in their hands, especially if they're wearing the student ID cards all day, to pick it up, look at the back and say, well, here's somebody I can call. I mean, this is prevention, and this is what we're trying to do too. It's a big part of it, and I think it is important.
Thank you, Ms. Nadler. I hear your urgency in the request, and I'm really grateful for the background details that you've provided here. So I want to just summarize what I've heard from the committee so far today. So it sounds like Senator Duniate will reach out to the bill sponsor on this, notifying her of the concerns that have been brought up around implementation today, and follow up with SEI staff about any additional feedback or communication regarding that. Rather than include this as a recommendation, I'd like to keep it as an agenda item for our November meeting at the very least, to be able to follow up to hear any updates from the committee members with regarding this particular implementation.
That's great. Thank you.
Any further discussion from the committee on this item? All right, hearing none, we can move to agenda item number 5, which is a presentation of the Prevention Subcommittee recommendations for the October 9th SURG meeting. As has happened in previous years, there'll be a report out of the Prevention Subcommittee recommendations and the opportunity for feedback from other SURG members. And then, as I have mentioned previously, we'll meet again on November 6th to incorporate any of the October meeting feedback and finalize our recommendations before they go to the full SURG meeting for voting. So if the committee is comfortable with it as chair, I'm happy to take the lead on presenting the recommendations to the committee. I'm open if there's anything specific that the committee members would like to be included, and happy to present any finalized language recommendations that we have voted on, and then indicate where we're still seeking feedback or development. And if you all can be available for helping with questions if they come up from the committee, that would be my ask. Open to any further discussion on this item as needed.
Yeah, Chair Johnson, you have my full support on that. You are articulate, you're able to tease out the nuances, and I think you do a good job of communicating the intricacies of why we made the decisions as we did. So yes, and I will be there for support however you need.
Thank you, Vice Chair Schoen. Hoping my internet holds up as it did today in that meeting
Absolutely. As well. Debbie Nadler, I 100% agree.
Thank you, Ms. Nadler, for your support. All right, fantastic. Hearing no further discussion, we can close agenda item number 5 and move on to agenda item number 6. This is our second period of public comment. Ms. Rodriguez did share at the outset the details regarding receiving public comment via Zoom and in dialing in from the telephone. So I am, if there's no additional information needed at this time, I'm happy to entertain any items for public comment.
Chair Johnson, I'm not seeing anybody indicating they would like to provide public comment.
All right. Thank you for that. With that, we'll go ahead and move on to agenda item number 7, which is adjournment. So I wanted to thank the subcommittee and staff and attendees for coming today and for all the work that you do to keep us safe and healthy in Nevada. I appreciate it, and we'll see you at the full SURG meeting in October for further discussion on many of these items. Thank you all.
All right, take care,
Thank
everybody.
you, Jessica. Thank you.
Thanks.